there's a lot of information that's going to be out there, negative and positive. I think you need to refer to the actual research and the clinical knowledge that has been given and passed on for, hundreds of years of effectiveness and safetyness of any of these remedies. So let's see. To clarify, it is not immune stimulating. It is immune modulating. It is very safe for autoimmune patients. However, in every single patient that has, or person that has autoimmunity, you want to always gauge your symptoms. Always. You won't know if you're Th1 or Th2 dominant, or if it's a problem with your T regulatory cells overall, and everything is stimulated, and so you would respond to everything. So there's a list of herbs that you can look at for that, and you would want to avoid those herbs. However, elderberry is not on there. Echinacea, astragalus, those are Th1 stimulants. Green tea, that's a Th2 stimulant. So you have to understand and learn your body. I know that most of the people watching right now are probably do not have autoimmune disease, but you might know someone who has, and that would be a person where you say, well, when you took the elderberry syrup, did you feel good or did you feel worse? When you took the echinacea, did you feel better? Did you feel worse? And if you feel worse, you stop taking it because it was overstimulating your system and it's going to make you more sick. So you have to listen to your body and really trust that. Let's see. So the advice is elderberry is super, super effective at the prevention stage, very effective. And then at the treatment stage. And that 1 tablespoon 3 to 4 times a day is kind of where most of the studies were landing, where they were, proving to be pretty effective there. And for prevention, what it was showing for at least the flu is that it actually is blocking the virus from getting into the cells. So you can use it for actively preventing. Now, COVID-19 may be a little more aggressive and it gets in there, but it still has the potential to maybe lessen the severity. So, keep that in mind. Once again, all of this stuff is empirical. This is all, we have no idea. I couldn't make a recommendation to you right now on this is the treatment that will save it, that will cure it, that will treat it. No, I would never make that recommendation. This is just what we have based on, the research that we have so far on these viruses that are similar. So take it with a grain of salt, and you use your intuition on it. So the next one is echinacea. And yes, I am choosing herbs that are easily obtainable here. There are a ton of Chinese herbs that are very hard to find right now. And if they're top on the list, you're not going to get any anyway because it's completely sold out. So I'm trying to put on here things that you could easily just grab locally or order through FullScript if you create an account through me, or something that might still be, be able to be restocked and available in abundance in America. So the echinacea species, there's multiple species of this, so this is important for you to realize. It's possible that it could help, but there's not a lot of studies on echinacea looking at that. They do have some, basically showing it is an inflammation modulating herb, but they have different species. So the purpura versus the angustifolia and the pallida. So the purpura is immune modulating. Angustifolia is the immune stimulating. However, it is inflammation modulating. So even though it says it's stimulating, for some people this could be totally fine, and it doesn't create the cytokine storm as we were suggesting. So the clinical trials actually showed that there was a decrease in the IL-6 and the TNF alpha, and an increase in the IL-10. So even though it's immune stimulating, and sometimes that equates with creating more cytokines and creating maybe an immune response in an autoimmune patient, it's not always the case. And these clinical trials and the viral studies have shown that they had a decrease in those particular cytokines. Astragalus is the next herb that I want to cover. So it's given, I wouldn't say like historically, but it's commonly given with licorice. And like I said earlier, licorice is not one that you would always just give by yourself. It works very synergistically with other herbs. And in a couple studies for SARS, they showed it in astragalus and licorice given together. And let's see, that the study was in 2012, and the author's name is Liu. It is also in a formula that was proven to be very effective in this article that I'm going to speak of right now for this this particular formula. Sorry, the paper was written by Yang, and that's in 2020. So this is for COVID-19. Jade windscreen powder is the name of the formula. But once again, this is one of the traditional Chinese formulas, and it was proven to prevent the cytokine storm. It was a treatment for pneumonia, and it has been a treatment for influenza, and it's inflammation modulating, so it increases all that inflammation. So it's been proven to be effective. This is one that we have for currently. And once again, the formula is called Jade windscreen powder. But one thing that's in it is the astragalus. And I believe it has a few types of astragalus. So this is why we say, well, here in the West, this is what we have. We do have access to the astragalus. So why not use the astragalus, use the licorice? These are things that we do have, even if we don't have our hands on this particular formula. The next one would be the Chinese skullcap, also known as scutellaria. It's not the typical scutellaria that we use here. It was hard to get hold of this herb as well because we wanted to use it in our formulas. But China is using this as another top 10 herb, I believe, or at least they're using it for COVID-19. So it does have studies that it inhibits SARS, it blocks the cytokine storm, and it antiviral in general. The next two that I'm going to talk to are about these, supportive herbs that are for all of those other systems that are being effective, aside from just the upper respiratory and, the lower respiratory and the lungs. So the Camellia sinensis, so this is the black tea, not green tea, this is black tea. And this is because of the tannins in it and so on and so forth. There's many constituents in it that it has inhibited SARS protease. I won't get into all of that physiology, but it inhibits it in the pharynx and in the gut. So all the people that are having symptoms from having diarrhea or nausea, and they're actually showing the damage that is done in the pharynx that leads to the lung. So if you can get that before, then this seems to be effective for it. This is easy to drink, especially if you want to substitute your coffee, if you're trying to prevent and you want to reduce that, if you have a negative effect with the coffee, if you need some caffeine, if you feel really down whenever you're sick, the black tea is a great thing to sip on. So the other thing is rhubarb for kidney damage. This is something I was just speaking with a naturopathic nephrologist in a way, like that's his specialty, and he said the rhubarb is what he's been suggesting a lot to his patients. I believe that it has been proven to affect and be very positive for issues with the prostate and urinary tract, and it's also been effective with this particular affinity towards the kidneys with SARS. So once again, this is none of this, except for a few of these things, but none of it is proven. All of these things are, they're empirical. You take it, you take the information, you see what resonates with you, and then you try it out. But for me, having these herbs, knowing the information behind it, knowing that this is research data, knowing that there has been with all the stuff that I just mentioned, none of those have had any clinical evidence of a cytokine storm. And I'm talking to herbalists with hundreds of years between all of them, thousands of patients between all of them, and they haven't witnessed this with those particular herbs. So I hope that this was informative. I hope that it helps you make your decision. I am in no way trying to tell you to use a particular herb for this COVID-19, but just to give you the information that is out there and try to understand the difference between in vitro studies and clinical trials, and tried to understand how an herb very commonly in the research is misrepresented by the way that they give the herb, the dosage that they give the herb, the fact that you think you put an herb into a petri dish or a tube of blood and expect it to react without effectively digesting the herb, effectively utilizing the herb. That's not how we would take it in our body. So how can you use that information? Plus, if you have, as with elderberry, 2 in vitro studies that should be null and void anyway, that's compared to the 20 studies that support it, that show the opposite of what they were saying. That's how science is. You have to go with the majority of what the majority shows and what is strongest evidence. And to me, the strongest evidence was it increases IL-10 and it decreases the other cytokines. And clinically, it's proving that there is no cytokine storm. So I feel very, very confident in that information. On top of all the clinical evidence that I've heard from my elders in the naturopathic community and the herbalist community, I feel very confident that it's a great preventative herb, that it is a good treatment herb, and but everyone should decide that on their own individual basis. So that's that. I would like for you all to go to Heather Jade Apothecary's page. She has great elderberry products, has most of the herbs that I have mentioned in some of her products. If not the tea, it's a syrup or a tincture or a glycerite. She offers all of those products, and it's a local source, and hopefully it won't be completely sold out by the end of this week. But if you need it, you reach out to her on the page, or you go to one of her vendors and try to get your hands on some of those products. We worked a while in trying to formulate based on the information that has been provided to us through the research and through these resources that we're using from our elders. So I would say message me if you have questions, but I am so busy right now, it's probably not going to happen. I am going to have a talk tomorrow night. So that's the 19th. Thursday the 19th. It's going to be in Mandeville, but of course, because of circumstances, it's going to be a very small group, but we will be streaming it on Facebook and Instagram. So because of that, I want you to be on the lookout to be there. It's going to be 6 p.m. tomorrow. I'm going to be talking about everything, every question, answering every question with the people there. And then if you have any questions online, I'll be answering those. And it's going to be based on multiple views about COVID-19. It's not going to be a lot of personal beliefs. It will be based on research and what's going on in different areas of the country and what I'm hearing from doctors all around the world. And so I can give you a better idea of how I'm seeing and how I'm interpreting the data. So hopefully you can make it. That's 6 p.m. tomorrow. That's Thursday. And Facebook Live, I'll put the links, and Instagram Live, I will put the links to where you can go to access that. And hopefully we'll have videos on afterwards as well. So thanks for joining me.